Hello all, I'm Dr. Santoshi Nagaonkar, Director of the Department of Urology, Urological Cancer Surgery and Robotic Surgery at Sir H.N. Reliance Foundation Hospital, Mumbai. In continuation of our series of conversation with various specialists who are involved in treating men's health issues, we have Dr. Bijal Dodia. She's with us today. She's our Chief Pelvic Physiotherapy Specialist, and she helps us in managing various men's related conditions. The reason why we are discussing this today is because of the month of November is observed as Men's Health Month, and various diseases which are linked with men's health such as prostate cancer, pelvic floor dysfunction, erectile dysfunction, testicular cancer, and etc. they are managed and promoted during this month. So I welcome Dr. Bijal. Thank you, Bijal, for being here.
Thank you, sir.
So my first question to you is, tell me how pelvic physiotherapy is helping us in managing especially men's health, maybe having urinary incontinence or various bladder disorders or pelvic dysfunction.
Pelvic floor abnormality is mainly related to the muscular structure, as pelvic floor itself is a muscular structure, and it is the muscle which coordinates and controls various functions like urination, defecation, or even movement of the sperms while sexual activity. So it is very important to have these muscles in a good health. How we go to the gym for developing a good biceps and triceps, it is extremely important for everyone to also perform pelvic floor exercises, which is taught by a proper professional. In this case, I would suggest a physiotherapist who knows the anatomy and how is the function of the pelvic floor muscle. And it is taught properly by a professional. It is practiced on daily basis, and that's how it is very important for any individual, including males and females, to practice pelvic floor exercises on routine basis, like call it as a pelvic gym.
Excellent. So can you tell Bijal that any physiotherapist who is working any private center or anywhere, can they teach you properly the pelvic physiotherapy, or there are specialized people like you who keep interest in managing pelvic floor disorders? They need to be involved in this care. What is your thought on that?
One should always prefer a specialist. There are physiotherapists who specifically practice pelvic floor physiotherapy. They are trained under somebody, under a professional who's himself or herself is a proper pelvic floor physical therapist. And this pelvic floor physiotherapy is a branch which needs an detailed and intricate learning. It is not to be done by any physiotherapist, and one should always go to a person who is a specialized pelvic floor physical therapist trained in this field and with relevant experience, because this is not to be done by any physiotherapist.
Exactly. So that is the most important part, because we generally think that any physiotherapist would be able to manage any physical condition. And it is just like going to any doctor to get any part treated, which is not the right thing, because he has specialists for various organs. And similarly, all the branches are getting sub-branching, and physiotherapy is no different to that. It is not an exception. So pelvic physiotherapy is a specialized branch, and the patients who are referred on to see a specialized physiotherapist, they should attend to a pelvic physiotherapist. So my next question to you, Bijal, is with prostate cancer being so common now, and we perform radical prostatectomy surgery, which is like complete removal of prostate gland, one of the potential complications of that surgery is urinary incontinence. And as we all know, there are different types of urinary incontinence. The commonest are stress incontinence, where on coughing or sneezing, you start leaking out urine, urge incontinence. And after prostatectomy, we generally encounter stress type of incontinence. So tell us the importance of doing physiotherapy, pelvic physiotherapy, in preventing and managing the incontinence?
Good question, sir. So, right nowadays, we live in an arena of prehabilitation. So, it is always better to be prepared before going for a surgery. So, I'll first talk about the preoperative and then we'll go on to the postoperative. So, preoperatively, like how we treat any patient undergoing surgery, preoperatively, it is very important for the patients to have good strength and endurance in pelvic floor muscle, irrespective of their symptoms before the surgery. So, as a physiotherapist, my job is to make the person teach pelvic floor exercises, mainly in terms of strength and endurance, get them prepared for the surgery, and post-operatively, in case they have, God forbid, if they have the incontinence, then we make them do similar kind of exercises, but the dosage and the frequency of the exercises remain different and they are at a little higher level. And of course, the follow-up of such patients having incontinence is more frequent compared to someone who is just coming for prehabilitation. So, pelvic floor physical therapy mainly focuses on developing strength and endurance, and eventually those who are diaper dependent patients, we target to also train them to get off the diaper, which is towards the end of his rehabilitation program with us. So that's how we look at it holistically. At the same time, we train them. We train them to do how to do toilet training. That is also something which we look at as a physical therapist.
Thank you. So that is the most important terminology what Dr. Bijal used, prehabilitation. And if you are encountering or expecting any potential complications out of any surgical therapy, then you start preparing your body beforehand, before you anticipate that complication. And that is the most important thing. The other thing which helps in doing prehabilitation is patients realize which muscle to contract before they undergo the surgery. Because after surgery, many a times it is very difficult to identify a specific muscle since you are still recovering. So it is very important to start such physical therapies before the surgery. Now, my last question to Dr. Bijal is, what other men's urinary conditions can be treated by pelvic physiotherapy or any other specific type of pelvic muscle exercises?
So far we spoke about pelvic floor muscles being weak. There is another entity called chronic pelvic pain syndrome, which is mainly because of the tight pelvic floor muscles, where the patient come up with unexplained pain in the pelvic floor and at the private parts, and it is associated at times with urinary incontinence or at times with inability to pass urine, feeling of incomplete urination. So when we examine, these patients have very tight pelvic floor muscles with lot of painful points when we check. So pelvic floor physical therapy mainly focuses on relaxing these muscles. At the same time, manually we try to release these tender points or pain points with the help of our techniques, and it is mostly associated with any dysfunction of the muscles in and around the pelvic floor, like hip joint or back muscles, or any abnormality related to the spine, the lumbar spine, basically the lower back. So that aspect is also looked after. So for a patient who's coming for chronic pelvic pain syndrome, it is just not the pelvic floor which is addressed, but also the area in and around the pelvic floor is also focused on, where certain muscles require strengthening, certain muscles require stretching, or maybe a combination of both. But pelvic floor in particular is a structure which becomes very tight and painful in this entity called chronic pelvic pain syndrome, and the symptoms can range from which is like contrary to the tightness, it can even range from dysfunction of the pelvic floor in terms of urinary incontinence, or as I said previously, inability to pass urine despite of patients trying it hard.
Excellent. So that is the bottom line. Again, it is physiotherapy has become an integral part of all the specialties involved in medicine, be it orthopedic, be it cardiology, be it urology, be it gynecology. So we cannot really ignore this branch. And as a matter of fact, it has become a kind of a coordinated effort between physiotherapists and any surgical or medical branch where the patient's outcome is totally changed, and it is in a positive way it gets changed. I will sign off from here now, and thanks Dr. Bijal for being here, and we'll continue our series of conversation for upcoming November, which is the Men's Health Month, and we'll keep promoting for a good cause. Thank you.